You know, in the 12th Congressional District, one of the things we did yesterday, we had a Resist Together town hall and training, because folks are showing up, and I want you all to be equipped, right? But also to understand what the real impact is of $880 billion cut to your community. So I'm going to show you, again, in numbers, but behind every number is a parent with a child that relies on Medicaid, is a mother who relies on prenatal and postpartum care, all of that. It is a person that relies on long-term care to be covered by Medicaid. So just remember with these numbers. So it is important to understand, again, what the impact is in the 10th Congressional District. So we know that tens of millions of Americans. You should know, as a founder of the Congressional Mamas Caucus, over 40% of births around the country depend on Medicaid. Yes. But I want you to see this. This is your congressional district. This is your backyard. Look how many individuals, 23% of Congressman John James' district relies on Medicaid. 23%. 69,000 of them are children, including 17,000 children who have disabilities or living with disabilities. Yep, exactly. And as a person that is a mom with an autistic child, I know how important it is for the wraparound programs and services. And let's be honest, you know, Medicaid is that Band-Aid to sick care in our country. We don't have health care. We have sick care. It's driven by profit. And one thing that Medicaid has done, though, because it's not a choice, it's a life-saving tool that has provided care for our families. 2,800 births per year in the congressional district. Again, that depends on the postnatal, prenatal. And we're just finishing up Black Maternal Health Week. Again, Michigan is one of the worst in the country when it comes to Black maternal health. 17,000 seniors, including over 1,000, receive care through Medicaid, long-term care. Next slide. I want you to know, again, about 2022, again, these numbers might not be fully updated, but I want you to see. Now, you see this number, you're like, wow, but that's your money. No. This is your money. Don't let them think that it's something that, this is the bare minimum of what they can do while they have big pharma and the health industry, again, being driven by profit. Right. We're subsidizing that with this care. It is important for you, again, to see, again, what the importance here of is that we're covering. This is something that would devastate a family. I've seen it. I've seen the people on private health care have to put a mortgage on their home or file bankruptcy because of medical debt. Next slide. Again, this is important for you to know that in the 10th Congressional District, 55,000 adults gained coverage through the expansion. Again, how many of you are on Affordable Care Act? The budget proposal, I am too. I know I'm not one of the millionaires that is in Congress. But one of the things to know is the data shows that it will be a 50%, 40 to 50% increase, the Affordable Care Act. That's about $630 per year addition of what you already pay with the $880 million that they're putting in there. Again, that's nearly $1 trillion. Again, it's really important. Next one. And I know Medicaid, what's important, again, for the economy, for you all to see, this is important, but hospitals, clinics, pharmacies, other health in the district among areas that are the largest employers that have deep economic ties to Medicaid. That's why you see Corwell and others. Now, again, they need to be checked too. I'm going to be on record of that. No, they do, because they have shareholders. Hospitals have shareholders now. Even though I have 501c3 status. Again, we have sick care in our country, not health care. So Medicaid is critical for the 10th Congressional District.